So more in the food. But here's the marae thing. So these guys are in front of a carved house, part of the marae. So people in these interviews said, if your marae is good, then you feel good. I'm feeling good about the marae. It's the satisfaction of knowing we're getting somewhere. So that's how people described their well-being, how they measured their well-being. So here's an actual marae. This is further down the coast from the fishing photos that I showed you. So this is a marae. So this is the sleeping house. You can see the importance of food because here's the giant dining room. So tiny little sleeping house, giant tiny dining room. They'll often have a church. This is a preschool, a kohanga reo. Whoops. There we go. There. So that's a Māori preschool. The photo's actually taken from behind the cemetery. So the whole complex to me is the marae, and that's the thing that people were talking about a lot in these interviews, saying if our marae is up and running and doing well, then I feel good, I feel healthy. We all feel healthy if our marae is healthy. And it's hard work to keep a marae running. It's all run on voluntary energy and you know, applying for grants wherever you can. There's, yeah, and yet a really crucial centre for Māori communities. And here's some, you know, some of the environmental stuff. So the well-being of us as a people is reflected by the well-being of our physical and surroundings. If we can keep our sacred sites healthy, then we'll all be healthy as well. You know, people talked about being able to connect back to the Earth Mother and the Sky Father and the God of the Sea, and they talk about this in quite practical ways. A lot of this, you know, I've gone through and selected a few choice quotes, but a lot of this is backed up with some quite practical applications of being able to fish freely, being able to get out on the land and to grow food, and you know, that's how people understood their well-being. So I guess the gap, like I've left quite a gap there, and in some ways it's deliberate, between the Māori policy I talked about earlier and this research that people have done for themselves. And what I would like to see is for policymakers to get together with the research that our community has been doing and to understand, try and get policy that works in with our current understandings rather than impose policy from the top down, and kind of get past the ideas of it's all about making Māori more like Pākehā people. It's all about bringing down rates of diabetes, and you know, I think it is about that as well. You know, and I've got a lot of diabetes in my own family, so I feel very strongly about it. And when we did these interviews, nobody talked about particular sicknesses or illnesses. They know they're there, but that's not, their measure of well-being is not necessarily about curing something that's already there. It's about creating something that they know they've experienced before and want to maintain and want to keep healthy. So I think especially with the marae is an area that policymakers could think about a little bit more, and think about what kinds of contributions do marae make to health of families. So we've got a very strong family-oriented policy in place in New Zealand at the moment. We have a Families Commission, and there's a lot of sort of public education about being a good family. And the marae is not quite a family thing, because lots of families will belong to this one marae. And so I have questions in terms of policy making about how do you think differently about you know, about families. How do you think differently about the contributions that Māori communities already make to families? How do you have policy support what's already happening for Māori communities, rather than constantly trying to come up, you know, sit in an office in our capital city and come up with ideas. There's plenty of ideas out there already, and people are, you know, doing this kind of research to develop and articulate them, and how can you get a nice kind of marriage of those things. Anyway, I think I've said enough. Yeah.